Actually, here slides in my laptop, slides only this full screen.
Okay, it's full screen. Then click on escape. Yeah, and make it escape so that the slides will be visible to your slide. Click on escape. Now click on second slide, sir, on the left side.
Are you able to see my laptop?
Now moving, sir, click on the second, then move down here, and it will be selected. Click on second. Yeah, moving. Yeah, it's yeah. Now on fifth, sir.
Okay.
Yes, sir. Now yeah, now second slide is.
Oh, this is completed. That is the reason now it is being shared.
Yes, sir. Now shared. Yeah. Now you can make it a full slideshow, sir. Okay. Otherwise, it will be okay, sir. You can share it from here itself. No worries.
Let me once again try because that is once I share the then once I do this one full screen, my slides are not visible. See,
okay. Keep it as it is, sir. No issues.
Let me know is it being is it now are you seeing the change of the slides?
Yeah, we are on second slide, sir. Right.
It is on third slide. Okay, it's second slide. Okay, is it moving now?
Second slide.
Nothing.
No, not moving. Click on escape, sir, first. Yeah. Now click on second slide, sir. Yeah, now moving, sir. Now moving.
Then let us not make it full screen, okay?
Keep
okay
it
now?
as it is. Yeah.
Okay.
Please continue.
Okay, thank you. So now now Rasayana Vidhi, should I repeat or it's okay now? Should I continue?
No, okay, sir. No, okay, sir. You continue, please, from here.
Okay. So now we stop with Rasayana Vidhi. So whenever there are epidemics and endemics and pandemics, then additional Rasayana should be given to the baby. Now the last one, Karmakshaya. Karmakshaya means whenever Karmakshaya is there, but the Bali, Dana, etc. should be done as Prayaschitta to avoid Karmakshaya. So let me explain what is Karmakshaya. The Karmakshaya means the diseases are not only acquired from this from the birth to this life, but many diseases, it is explained in our Ayurveda, many diseases carried from the past life. So whatever the deeds we have done, and those may be the nidana for the existing disease. For that we have to undergo karmakshaya. So for that Bali, Dana, etc. have been mentioned. This in latest term it is known as the the regression therapy. And this regression therapy is discovered and it is being practiced. In regression therapy, what it is done, the person's mind or manas is carried by through special technique into the past life, and what happened in that past life is known, and then it is understood the etiology of the present life, and based on that later on counseling is given to the child or person. That is known as regression therapy. So regression therapy is nothing but is a measure of treating karmakshaya. So by this is the only the outlines of the preventive pediatrics mentioned in Ayurveda I have completed. So this is now coming to the Karnavedana Samaskaram. Is it okay? The slide is changed, Poonamji?
Yes, sir.
So now our Karnavedana Samaskara is to initiate the immunity of a child in general. At the appropriate age is the topic of concern here for scientific study in this presentation. Now, this slide shows the reference from Sushruta Sutrasthana. So it is here very clearly explained and the objective of Karnavedana Samskara and the how to be done and when to be done and the what is the method of procedure. Everything is explained here. This is the further I explain. Now it is the Sutrasthana this reference. He describes Karnavedana Samskara for the purpose of Rakshana and Bhushan. The Rakshana, that is protection against harmful microorganisms, is attained by triggering the immune mechanism at the right age. Defense mechanism mentioned in Ayurveda and allopathy has been convincingly brought together. Hence, the immunoglobulin count is considered as a parameter to gauge the degree of immunity improved in the present study. The results in this study are proved hypothetically this piece of work is scientifically prove how Karnavedana Samskara triggers immunity in a child at a proper age and thereafter providing protection for the subsequent attacks. The aims and objectives of this: to scientifically evaluate the role of Karnavedana Samskara in initiating immunity, to study the significance of the age group 6 to 8 months as the perfect age to trigger immune mechanism. Finally, to save the least few infants from the microorganisms and their consequent disease with this cost-effective procedure and to shape a healthy India. So now regarding a literary review about Karnavedana Samskara, Sushruta Sutrasthana, Ashtanga Hridayam, Ashtanga Sangraham, Kashyapa Samhita, Paraskara Griha Sutra and Haramekhala and Kumara Tantra Samuchaya. So in all these texts, the Karnavedana Samskara is explained. So for the protection of the child, for ornamental purpose and the certain season is mentioned, but it is mentioned by Dalahana. So it is not but we are taking from the age of the child, based on the age of the child. And the prior to Karnavedana Samskara, like any other Samskara, we have to select an auspicious this auspicious nakshatra, etc. And then we have to follow the procedure. In the procedure, urgent
Please turn off your mic.
So some surgeon has to be. Hello.
Hello. Yes, sir, you are okay.
May I continue, please?
Yes, sir. Yes, sir.
So surgeon has to till now it is and has to got lateral.
You have to switch off the audio. Laptop. You have to mute the laptop, sir. Yeah. Both devices.
See, you can see my device.
Click on mute button. Click on mute button, sir, of laptop.
Because my voice is the speaker is off here in the laptop.
Now okay, sir. Now.
Is it okay now?
Now. Yeah, please continue.
Okay?
Yes. PPT.
So here the Devakruta Chidra, where fine bore should be made with his right hand slowly. A rolled cotton thread should be pushed inside and made wet with amataila. A cotton thread soaked in oil should be drawn through the puncture and site bathed with amataila or tilataila on processed oil. So instruments, the needle is this curved needle. In Shastra, it is for needle is sufficient for thin pinna. If thick is Shastra is mentioned, but here we have used a curved needle.
Sir, please unmute your mic. I think it's off.
Which
Yeah. Now audible. Yeah.
Even now this one is not changing. My slides are unable to move.
Unable to move?
It is seized. Screen is seized.
Okay. Press escape button, sir, again. And then click on the slide itself. 11 slides, sir.
No, screen is seized and it is not responding. Even escape button.
Okay, not responding. There is network issue, sir?
I don't network is not network issue.
You can reshare it again, sir. Click on stop sharing and share it again.
Now it seems now it is working. Let me see.
Okay.
Okay.
Now.
It is on. My voice is not echo, no?
No, not. Okay, sir.
Okay.
Please continue.
So now the procedure, infants, parents who have next the sample collection. So after there are two groups. One is the Samskara group. The 30 children are selected and 30 non-Samskara group. So once the blood sample is collected for the evaluation of serum, immunoglobulin, IgG and IgA, complete blood picture prior to conduct in the Karnavedana Samskara. Complete history along with the physical examination is recorded as per needed. Children are made to sit in the lap of their mothers, engaging them with the toys of their interest to divert the concentration from the samskara process. Then infant ear is exposed to good amount of sunlight and a highly transparent translucent area is marked with the marker. The point marked on the ear pinna is punctured with a curved needle which is attached to the thread on one side, and the thread is tied with a knot. The little amount of blood is moved with cotton, and then process should with tilataila is applied over the puncture. As it is in the text, female child is punctured on the left lobe first and male child is punctured on the right. The thread is replaced on every 45th day for the sake of the convenience to the parents, since the children volunteered for the study are from different parts of Andhra Pradesh. Again, after a period of 3 months, the investigations are repeated in the similar with 30 other infants for the sake of comparative study are subjected to the same investigation twice with a similar gap of 3 months, but without samskara. The investigation of both from samskara and non-samskara groups are recorded for further statistical analysis. Now the criteria for assessment. The improvement in the immunoglobulin count and reduction in the clinical features is considered as marked improvement. Improvement in the immunoglobulin count or reduction in the clinical features, anyone among the two is considered as mild improvement. No improvement in the immunoglobulin count, increase in the clinical features is considered as no improvement. Thus, data collected from the study is treated and analyzed statistically, and the difference between before the treatment and after the treatment in samskara and non-samskara group is calculated for the evaluation of the statistical significance. So now the various graphs they related to the symptoms developed and their improvement in the first the samskara group. See, in the samskara group the chronic diarrhea was less and non-samskara group was more, and after treatment, after samskara, in the samskara group is brought down when compared to the non-samskara group. The fever also, in fever also they see in samskara group the percentage is brought down in samskara group, and the fever relatively less improved in non-samskara. Skin rash, even skin rash also, see there is a very good improvement in samskara group. The percentage in non-samskara group is not to that extent. You can see in the graph. Now weight gain. Weight gain is also good in samskara group and in non-samskara group. The percentage is very less when compared to the samskara. Eczema. See, eczema is also the percentage of relieving from the eczema in samskara group is very good, and whereas in non-samskara group is not, it is there, but it is not to that extent in samskara group. The candidiasis. See, candidiasis in samskara group and non-samskara group, in both it is completely disappeared. The common cold, see here, the common cold is a very good relief in the samskara group. Almost it is 80%, 68%, and in non-samskara group it is not relieved to that extent. The stomatitis. The stomatitis is also see in samskara group is the very good recovery, and it is not to that extent in non-samskara group. Pneumonia. See, there is no incidence of pneumonia in samskara group, but still there is good number of children suffered from samskara in the pneumonia in non-samskara group. The nocturnal cough. The nocturnal cough is very much brought down in samskara group, and whereas in non-samskara group there is no relief at all. And otitis media. The children of samskara group were relieved very much from otitis media, and there is no improvement in non-samskara group. And see, recurrent UTI, this is urinary tract infection. See, here this is the different one. In samskara group, some children suffered from urinary tract infections, whereas in non-samskara group there is no such. See, why this we will discuss later. Now T-cell defects. T-cell defects are very good relief in samskara group, and in non-samskara group relieved better, not to that extent when compared to samskara group. Now the positive family history. See, the complaints, the disease or illness suffering in children. See, similar history was present in the family. So in samskara group, though the history was present, in samskara group the recovery is very good, but in non-samskara group almost negligible improvement wherever family history is positive. And the frequency of the complaint. The frequency of the complaint is very much brought down in samskara group, and there is no much improvement in non-samskara group. So in the gastrointestinal tract, see in the blue color it is gastrointestinal tract, and the red color one is respiratory syndrome. See in the GIT tract, the relief, but in respiratory system there is a very good relief occurred in samskara group. Now this is a very important slide. So far, based on the so far improvement and unimprovement based on clinical features. Now this is the slide. We have done the immunoglobulin estimation. See, the blue color shows the samskara group and the red color shows the non-samskara group. See in blue color, you see the immunoglobulin A is very much improved in samskara group, and whereas in non-samskara group is not improved. There is improvement, but see there is difference between two very large variation. And this immunoglobulin A is responsible for the respiratory resistance. And see IgM, immunoglobulin M is also very much improved in samskara group and compared to non-samskara group. And immunoglobulin G. Immunoglobulin G also very much improved, they increased when compared to non-samskara group. See duration, the duration of the illness is also very much decreased in samskara group, and in non-samskara group there is no change. The duration of the illness was as it is. Now the results which are acquired, now we will discuss. So that only the upper respiratory tract, urinary tract infections were very good improvement in non-samskara group. This is because probably UTI is uncommon in deficiencies. So that is the reason why there were no UTI cases in non-samskara group, and the samskara group there were UTI. That is the difference. So now the Kannavidharma samskara is done during the 6 to 8 months stage. The amount of immunity obtained from the mother in the form of antibodies, that is IgG, IgM, remained in the infant till 6 months. The later on they decrease because there is no sufficient amount of antibodies carried through the breast milk. So this is the appropriate age to perform the Kannavidharma samskara. That is 6 to 8 months. That is the reason why in Vagbata said, Shet Saptam Astama Masheshu. So then, our investigation, after 3 months gap between the investigations. So the investigations, blood sample is collected soon after the Kannavidharma samskara, then after 3 months. See why in both samskara group and non-samskara group. Why this 3 months group means, if an antigen comes in contact to the body, the immune system starts fighting and reaches the peak of immunoglobulin on 15th day. They reach normal levels by 16th day. Again after 60th day, exposure to the antigens for the second time make the memory cells of the first attack to fight. Imagine, Kannavidharma samskara as the first attack by microorganisms, and the second attack might be the place any time after 2 months. So 1 month time is given for exposure to the second attack. So that is total together 3 months. That is the reason why second investigation is blood sample is collected at the end of 3 months after the Kannavidharma samskara, or in samskara group also the same. The thread that has been used for this samskara is a tensile 20. What is generally used for Kshara Sutra preparation, it doesn't have special properties except for its good absorption capacity and non-stretchable nature. It is neither too thick nor too thin. Now, the after the Kannavedana Samskara, the wound is over wound. The thread thread is soaked in Tilataila and inserted with the help of the needle, and the wound is over the wound Tilataila is applied, and changing of the thread has been once in 45 days. But in the text, it is mentioned on alternate days. But we have done after 45 days. See, there isn't a single patient among all the 30 infants who developed complications after Kannavedana Samskara. The point of Kannavedana Samskara is marked by exposing to the air to good amount of sunlight and marking a highly translucent area with a marker and then piercing. The procedure that is exactly mentioned in the Samhita holds good and is proved to be highly noteworthy. So, how does this Kannavedana Samskara works? See, work. Probably the lymphatic system is stimulated, resulting in the production of large number of lymphocytes and other immune cells, which help defend the body against microorganisms and against harmful foreign particles, including the antigens associated with the GIT and the respiratory system, etc. The immunity is triggered instantly after Kannavedana, which provides the ability to recognize and remember specific pathogens that have come in contact with the body during the procedure, and finally mounts stronger attacks each time the pathogen is encountered, that is to greater immunity. Kannavedana cannot be placed under natural or acquired immunity, since it is not a natural process, and during the process the child doesn't suffer from any specific illness. Kannavedana is artificially induced, but as like vaccination, it is not specific to a particular disease. It is an active form of immunity, since live pathogens are exposed to the wound. So, Kannavedana could be taken as artificially acquired non-specific active immunity. And finally, Kannavedana Samskara doesn't cause illness in the child, even the infant is exposed to the live pathogens. Since the wound that is caused by the Samskara is so small, probably the amount of pathogens that come in contact with the body may not be sufficient enough to manifest a disease in full length. Now coming to the conclusion, see, Samskara is one of the such kind which triggers immunity at a proper age. Kannavedana Samskara is found to be highly effective on upper respiratory tract ailments compared to other systems of the body. 75% of the respiratory ailments are checked with the Samskara, which is statistically proved to be highly significant. The increase in the immunoglobulin count, especially immunoglobulin A, is noted through Kannavedana, that is an immunoglobulin that attacks the pathogens of upper respiratory tract. The improvement seen in Kannavedana Samskara in each disease is as follows. As the passive immunity acquired from the mother declines by 6 months age group, 6 to 8 months for Kannavedana holds to be ideal. Finally, Kannavedana Samskara is cost effective and is affordable to the lower economic the classes too. The Kannavedana Samskara can be artificially acquired non-specific active immunity. The work done, this work actually is done by Dr. Paidi Rajani under my guidance. She has incurred a lot of energy and financial resources to complete this task. So I feel that it is time to acknowledge my thanks to her and all this procedure. Whoever is watching this program, if at all any policy makers are present in this program, I earnestly request there must be an initiation that our Kannavedana Samskara and Jatakarma Samskara, that is Swarnaprashana Samskara, must be incorporated under National Immunization Program. If not right now, but after appropriate scientific studies under an authentic research institution, then at least them it is to be. Because already it is on our tradition. The Kannavedana Samskara, it is a part of our tradition, but at the same time it gives immunity. Though this is a small sample, but this is supported by very scientific sound evidence, immunoglobulins and estimation and clinical features. So by this I conclude my presentation. Thank you one and all, and I extremely sorry because of these technical problems there was some interruption, and thank you one and all. Over to Poonamji.
Thank you very much, sir, for your detailed elaboration and wonderful explanation on Karna Vedan Sanskar in children as an immunoinductor. Thank you for sharing very informative session. And now it's time for question and answer session. If anybody is having any question in mind, they can ask. Anybody would like to ask any question, they can ask. Questions are invited, or anybody would like to share their views, they are also most welcome. Nobody else? Jayesh Thakkarji, do you want to ask anything? I think he has raised his hand. Yes, please.
Thank you, sir, for the nice presentation. I would like to know, is it done on both the year or 1 year is sufficient? And especially about the boys, how to convince their parents. And if any child is missed after 8 or 9 months, is a elder child, say for 3 years, can we do it then also to prevent the upper respiratory tract infection?
Yeah, see, it should be done on both years. That is one point. And if actually this Shet Saptamastama Maseshu is the reference from Vagbata, and Sushruta said 6th and the 7th month, that Pariskara Sutras, it is mentioned even 3rd year. 3rd year, 4th year also, 3rd to 6th year also it is mentioned. But the scientifically it is the 6th, 7th, 8th months are very much ideal, because at this moment the antibodies acquired from the mother are declining. So this is the right time. But as such, in other texts it is mentioned, even later on also can be done, up to the age of 3rd year also it can be done.
Thank you. Anybody else would like to ask? Any more questions from the viewers? You can please unmute your mic and ask, or can raise the hands as well. किसी भी तरह का सवाल है आप पूछ सकते हैं. सुमित्रा देवी मैम, do you like to ask anything? सुमित्रा देवी मैम, I think उन्होंने
hello.
जी जी मैम.
Hello. Thank you, sir, for the very elaborative and informative session. Ma'am, I would like to ask what are the classical and scientific reason for the better immunity in Karan Vedic Sanskarit child?
See, that is what I explained in my discussion. See, in Karnavedana Samskara, see what we are making a wound in the earlobe, which is a highly circulating area. The allowing the whatever the pathogenic organisms are present in the environment into that wound. So to that wound, our immune system responds in the form of immunoglobulins and forming antibodies. So this is what takes place in the Karnavedana Samskara, and that we have estimated. In Karnavedana Samskara group, the immunoglobulin A is very much improved, and immunoglobulin G and M are also improved, when compared to the non-Samskara group. So immunoglobulin A is very much improved. That means immunoglobulin A is responsible for the improving the resistance in the respiratory system. That means he is very much immune against respiratory disorders causing organisms. So this is what I explained in my discussion. So it is a very scientific method to improve our immunoglobulins, and thereby antibodies are developed, and these antibodies in our future life, they fight with any such organism, child is exposed to any such pathogenic organism. Is it clear? Is it clear, madam?
Okay. Yes, sir. It is clear. Thank you, sir.
Thank you. Anybody else would like to ask anything? You can please unmute your mic or can raise your hand. Any more questions from the viewers? Okay. Now we may conclude our today's session. Thank you very much, sir, for sharing wonderful session with us. It was really very informative. Now, to extend a vote of thanks, I would like to invite Dr. Paritosh Jha.
Thank you so much, ma'am. Good afternoon, everyone. It is an honor for me to have the opportunity to propose a vote of thanks for the 85th webinar of Gyan Ganga-a, a knowledge-based webinar series organized by s.r.t. On behalf of organizing committee, I want to express my gratitude to our respected speaker, Dr. N. Krishnanya sir, for his knowledgeable explanation on the topic, preventive pediatrics in Ayurveda, with special reference to Karma Sanskar as an immune inductor. Thank you so much, sir, for enlightening us with your detailed discussion on the topic. I would like to thank wholeheartedly respected Contribution Rep. Shri Devendra Trivulani, President Governing Body of RAB, for his blessing and continuous encouragement. I express my humble thanks to Dr. Manoj Ray sir, Advisor Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. I extend my heartfelt gratitude to Dr. Anupam Srivastava sir, Director RAB, for his constant guidance and motivation. I thank him for his valuable contribution and encouragement. I must thank organizing team of RAB and volunteers who work behind the scenes for their tremendous effort to make this webinar series a great success. Topic and speaker for the next webinar will be shared with you very soon. Thank you all and have a nice day.
Thank you, everybody.
Okay, thank you, Ananda.
Thank you so much, sir.